Hello there, welcome to Frontline. I am Obiora Ilo. Today we are revisiting the health sector. You remember that months ago we visited the health sector when we had the pleasure of hosting the Minister of Health, Professor Onabulele, who spoke on effective healthcare for Nigerians. Today we'll be looking at how to make healthcare, primary healthcare, available to majority of Nigerians. And later on in the program, I'll be joined by the president of NMA and a doctor who is also involved in women-related issues and how to help primary healthcare in Nigeria. We also bring you, in your own words, and our Vox Pop on the health sector. Don't go away. Frontline returns in a moment. You're still watching Frontline on AIT. Not too long ago, we had the pleasure of hosting the Honorable Minister of Health on this program, and we looked at effective healthcare for Nigerians. On popular demand today, we are revisiting the health sector, and today we are looking at how to make health available to majority of Nigerians. And joining me is the president of the Nigerian Medical Association, Dr. Osahon Onabulele. You're welcome, sir.
Thank you very much.
To our program.
Thank you.
And also on the program today is Dr. Ejike. Dr. Ejike is country director of IPAS, an NGO that concerns itself with protecting women's health and advancing women's productive rights. He's also a physician. Gentlemen, you're welcome to our program.
Thank you.
Thank you.
How do we make health care available to majority of Nigerians? And I think we should start with primary health care. What should the government do? Or what should the government do better than they are doing now to ensure that primary health care, which is what majority of Nigerians really need, gets to the average Nigerian? Let me start with you, Mr. President.
Thank you very much. Well, it's a very germane question you've put across to us, because again, worldwide, it's agreed that primary health care should be the cornerstone of healthcare delivery in any economy, because it subserves over 75–80% of the population, and of course attends to over 75% of the disease burden of any economy. And so it's expected that any country that means well for the health of the people should necessarily devote a lot of priority, very top level priority towards driving the primary care system and ensuring that there is some level of synergy between the primary care system, the secondary care system, and of course the tertiary care system. And so in the Nigerian situation, we have an extremely laid back primary care system. In other words, we've had an extremely neglected primary care system in the Nigerian healthcare system, and that has resulted from years of cumulative insults, as a result of misadventures, in governance, which of course you cannot divorce from the very poor state of primary care system in our country. And so, again, is the fact that the constitutional responsibilities have not really helped matters in terms of making health, be on a concurrent list, and that simply has meant that there has not been any clear delineation, of responsibilities. It's only a policy framework that has even enunciated the fact that, yes, primary health care system should be under the, within the purview and jurisdiction of the local government administration, secondary health care system within the purview of the state government, and of course tertiary health care system within the purview of the federal government. And so that has meant that people, even at the local government level, paid over the years lip service to primary care system, because if the policy says, that it's your responsibility, most of them get scot-free because they do not see that as even defining enough or as even obligatory enough, because it's not legal. And that is why the issue of the National Health Bill is very paramount. as to helping to also, partly define the roles and responsibilities. So to revitalize local government system, the primary care system, is also to drive this new reality as to the empowerment of the local government system, local government administrative system. Because you and I know that in today's Nigeria, one of the very obvious deficiencies is a lack of, functionality at the local government system level, which is supposed to be the closest to the people. And that is what primary care system is all about, bringing healthcare to the people.
Okay, Mr. President. Let me talk to Dr. Ejike. Well, we've heard some of the issues he raised. What other factors affect the effectiveness of primary healthcare in Nigeria?
I would say that my president has actually enunciated the main driving force. And I always like to break these things in 3 levels. 1, whose constitutional responsibility is this? 2, how have we supported that constitutional responsibility, given ability for that level of government to be able to do their work? And then, have we defined what should be done at that level? And if you look at it from that angle, everybody has agreed that the local government system has failed in terms of getting dividends of democracy to the people. It's not just in health. And then when you go to the local government to see why are these things happening, you see some local governments accusing the states of not giving them their resources. They take out everything and just give them enough money to pay salaries and a small money to do a semblance of things happening. But if you come to the purview of the health, the only way for now we can fund primary health care system, which is sorely missing, is by making sure that the National Health Bill, like you said, is put into action. Because that bill provides that 2% of our national consolidated revenue should go into that if the act is passed into law. And that means 50% of those resources will go to the local government level directly. It will inform training and retraining of care personnel, and usually most of the people who will be at that level will be nurses, midwives, community extension care workers, and even some pharmacists, and even doctors in some states. In some states, doctors are actually at the local primary health care level. And then that also will inform procurement of equipment and putting infrastructure in place. So the most important thing, like St. Aquinas law will say, what is the first mover? The first mover now is resources. And when we talk about resources, we're not just talking about money. Because in the healthcare system, money is as equally important as the people who will do the job.
The human resources.
The human resources. The capital, the human capital that has to drive that process. And if you look at the disparities in the way medical personnel are dispersed in the country, most of the care personnel are in the urban centers. And the reason is simple. They are looking for a better life. But if you make it mandatory that these resources are spent in the primary healthcare level, that means the distribution of nurses, mostly, will very speedily change. And we've seen it work already. In terms of the midwifery service scheme, which some of us were part of conceptualizing and pushing for, the midwifery service scheme has actually proven that if we take nurses to the rural areas, we can even reduce maternal mortality. You can see what is already happening to our maternal mortality. It fell from 1,100 to about 545 right now, within a purview of about 3 to 4 years.
Okay, we'll do more in the course of this, talking about this. But let's go back to some of those issues you raised, the local government and all that. And a lot of people are asking, why would that level of healthcare, which caters for more people, be left in the hands of the weakest tier of government, the local government? That's one. And people are also asking, why do at the local government level, they draw money from the federation account for primary health care. And there is no law saying that they have to report back to anybody to say this is what we have done, so that you can tie it to say, okay, you've done well, 80% well, so we give you more money. Just like the funding agencies do. They give you money, you have to account for the money before you get more money. Why is it so? And you being the president, I'm sure this should also be worrying you.
Well, I think from my own perspective for this, in terms of proactive, purposeful proposals, has to do with constitutional reforms. I want to domicile whatever proposals I have within the constitutional framework of Nigeria.
Okay.
Because health today is not, health rights today are not even in the constitution in the first instance, talk less of making them justiciable. Because it is not as if the local governments cannot deliver health or primary health care to the people at those levels. Well, like I said earlier on, we have a dysfunctional local government system in our country. So the choice we have as a country is either to continually go along this kind of systemic malay, or to agree that we need to revitalize it. Revitalizing it means getting all the resources and powers, enabling the local governments to function as a local government system, all right, within which they can also deliver healthcare to the people. And that is by way of making a constitutional provision, even in this constitutional amendment process that is going on, that provides for the responsibilities of local governments in terms of health, the responsibilities of the local government system to the people of the local government, and making their rights at those levels, whether in terms of preventive care, in terms of promotive care, in terms of whatever, justiciable, so that they can also demand, because I talked about the issue of giving and not feeding back.
Yes.
One way they can make them feed back is by ensuring that there's some level of accountability. In other words, empowering the people to demand accountability from the leaders at the local government levels. Because it's one thing to have a policy framework, but it's another thing to be able to implement it. But if the people know that even the Constitution guarantees their rights and gives them the ennoblement to demand for an expression of those rights, that if a local government chairman, we all know, in the name of fiscal transparency, as we're giving X, Y, Z amount of money, and we are a very responsive and, of course, vibrant people at the local government level, the likelihood is that the people at that level will demand for an expression of those rights, for an account to be given to them at frequent intervals, so that nobody can take them for a right with impunity. So I think first is to agree whether we still want the local government system to exist, all right, and if it has to exist, to agree on the need to, of course, make it functional
and effective,
and then to impute in it some accountability mechanism.
Okay. Dr. Ejike, some people have said that part of the problem is funding, and others say the problem is not funding, but it's management of financial and human resources. And that takes us to the PPP, private-public partnership. How can that help the health industry?
Yes, I completely agree with you that it's not just about resources, also how it is being managed. But just before I also go into that, I just want to make a small comment about what my president has just talked about in terms of responsibility of the people to their needs and the rights. Part of what we tell our women groups when we work with the women is that when you show up in a health post, you're not going there beggarly if it's a public site. You are going there to demand
for service
a promise that has been made to you by the people. So don't be beggarly. And it means people need to know their rights, but they can only do that if they know their rights. And it's also important to say too, if we continue doing more policies, more laws, problem will still exist if we do not make people to do the work they were elected to do. In government, the monitor and evaluation component of government is the legislative houses, be it at the local government, at the states, or at the national level. The legislative houses are the monitor and evaluation component of a civil dispensation. They have the oversight function. So I feel that has to be enabled. Having said that too, coming to what you talked about in terms of bringing efficiency, I'll give you a simple example of why this is important. In one of the states, when I make it a point during Christmas, when I travel, I move around the local primary care sites. In fact, some secondary care facilities. In one of the states, an assessment was done. And they found out there were about 50 sites that can produce service. Now, in those 50 sites, about 20 of them had a freshly dug boreholes for water. But you know, in those sites too, when an assessment was done, 25 out of those 50 sites didn't have a gometrin. A gometrin is a uterotonic, is a drug that you give to a woman immediately she delivers and the placenta is out, the womb is out, to make sure that the uterus, that is the womb, contracts and the woman should not bleed to death. The highest number of deaths come from postpartum hemorrhage as we speak. That means when the woman has finished having the baby and the placenta is in or out, the woman will bleed to death. Now that drug, if you give it to a woman, it stops the bleeding. In those sites that about 2 or 3 million was used to sink one borehole, and about 10 or 20 of them, they didn't have a vial that cost about 10 naira. So what do you call that? Is it that they didn't have money?
It's mismanagement.
Most women probably will not die because there's no borehole. The services might be of poor quality, but a woman can certainly die if there's no ergometrin to give to her and if she's bleeding immediately after delivery. So these are some of the things that we're talking about. It's not really that we do not have enough resources. Yes, we might not have, but the resource we have, how strategically are we deploying those resources in terms of paying attention to the simple and basic needs of a healthcare system? And I liked what you said. Today we're not going to be talking about hyperfalutin things. We're going to be talking about the basic, simple, and I call them stupid things that we could do. And if you come into public and private partnerships, when we talk about PPP in Nigeria, occasionally people think you build a hospital as a government and hand over to a few Nigerians to manage. What you have done, you have taken the collective wealth of a country and given to a few individuals. Rather, I want to take a leaf from what our Minister of Agriculture has done recently, because I saw him one day at the airport, and I said, I want to shake your hand and shake it very well. I'm proud of what you have done in the agricultural sector. In one fell swoop, he removed all the corruption that is in fertilizer distribution by using the electronic envelope, making sure that the subsidy government was giving to farmers went to the farmers directly, cutting out all the middlemen, and the fertilizer of better quality. If we want to do PPP in health, I think government can also support health institutions to do the same. Give the health institution ability to be able to go to a local commercial bank to borrow at single-digit rates of interest rates, not 20-something that we're seeing right now. And at the same time, making sure that that money is also guaranteed by the central bank, and make sure the doctors get the money directly. And not only that, it might be also, there might be a need to make sure that any doctor that is also coming to take that kind of resource must have management training. Because it's not just good to be just a doctor to be able to manage a hospital. You must have management ability. Otherwise, you will run into trouble also trying to manage. So it's a mix of some of those things that if we really do it, I'm telling you the healthcare sector will jump. Okay. Most of doctors can't get money. I saw a friend of mine yesterday. He has a big hospital. He wants to expand. But no bank wants to give him money.
You can buy equipment.
Because the gestational period of doctors being able to pay back is a longer time.
Yeah. Okay. A study was carried out in one of our states. And they said that some of the factors that affect effective primary health care included high cost of drugs, transport challenges of going to the health facilities, and, bad roads and all that, easy access to traditional healers and patent medicine dealers and quacks, because in the village you could access them. So if you could access them and you know that you have to spend so much money that you don't have to go to the city, they deal with them. There was a fourth reason: attitude of health workers.
Sure.
Where people come and they are not attended to. Let me read something that Olike Ransom Kuti said when he was leaving the Ministry of Health in the 90s. He said, "My only regret as I leave the ministry is that I have not been able to mobilize all health workers behind the medical system. Most health workers are only interested in how to maintain their position in the health system and not how to move the health system forward. And you will remember that Ejike Ransom-Kuti was one health minister that came with a lot of reforms, preventive medicine, preventable childhood diseases,
to primary healthcare.
Yeah. And you also remember that he faced a lot of opposition from health workers who prefer the old corrupt system. You are the president of the Nigerian Medical Association.
Yeah.
How can we fuse your members together and the other health workers, even in the bad situation we found ourselves, that they can help in making our healthcare more effective? How can we do that?
Yeah,
because today I see them fighting the Minister of Health,
yeah,
and demanding for his sack. And of course, NMA says they don't support that and all that. But why do we have these frictions? Is this that there are old habits they don't want to kick?
No, it's a very, very sad reflection of how we found ourselves as a country. Clearly, because there have been certain things that have happened in this country that have given the impression that we are not interested in, maintaining standards or adopting what we consider as, international best practices, norms of professionalism, and of course standards. And so everybody believes that within the democratic space, for as long as you can make the loudest noise, and make the greatest agitations, then of course your voice will be heard and you get all the privileges and all whatnot, in spite of professional standards. That is a very sad reflection of how we've come as a country. And that is why even as a professional organization, we are every day trying to preach professionalism and ensure that people reattune themselves to professional ethics, ethical conduct, ethical realities, and professional realities. As to say, no longer my issue, no longer my territorial conquest, but the patient care. My attitude should be preeminently that of caring for the patient, be centered on the patient's existence, recovery, healing, and not me. Yes, you can't discuss about your own welfare, but that should not preeminently take control over your duty and responsibility to the patient. That is what we are preaching as an organization, all right? But we are preaching that also with the intent of driving everybody along the same stream, to appreciate and understand that unless we all have this, then of course, even our people in the rural communities cannot get the best from us, even after we have trained with taxpayers' money to acquire the knowledge, to acquire the skills that, of course, we have been endowed with.
Mr. President, something happened just after Christmas. I had a health challenge, and I needed to see a doctor in a teaching hospital. And when we got there, we discovered that there were no consultants, and we made calls. And the consultant said he wasn't resuming until I think the 7th or 8th of January. But if I needed to see him in his clinic, I could pay 100,000 and he'll be available. And you're like, even if we provided all this, all the equipment, with that kind of attitude, will the patients get, how many Nigerians can afford 100,000 to give a doctor when that same service the doctor is paid for to provide it in a government hospital?
Well, I do not know the circumstance under which you interacted with the doctor. It's possible there are certain factors that may have occasioned his non-availability at that point in time. I mean, perhaps if he was on leave, for instance, clearly he will not be at his duty post because the doctor is entitled to his leave.
Well, he wasn't on leave.
Yes, so if he was not on leave, then it's possible also that, of course, there. Again, I think this is very interesting. I think I've always tried to let people appreciate also that, look, even as we appreciate that, look, there are sensitivities and sensibilities, especially of the people, but we must also appreciate and understand the fact that there is a way the hospital runs, and this is without defending any ill situation. That there are ways the hospital system runs, and that is not a system where you can just jump in and you think that everybody just rushes after you. There are cadres of operation. There are cadres that you need to go through, especially in that kind of hospital that is a specialist hospital where you have a consultant. Because it's only in the primary care center that you may not find a specialist. All right, and so there are cadres. He will not just be the first person that will come and see you. There are other cadres that will attend to you in the first instance. Number one, you have to see the record staff who will give you a card. From there, they have to program you down to see the doctor. From the first aider doctor, if he's not adequately convinced as to his capacity and competence, he calls the next guy. The consultant is actually the height, all right, of that cadre. So that before you even call a consultant, I think you even had the privilege, you know, of getting access. So, I mean,
phone number of the consultant. Yeah.
So we also need to appreciate how the hospital system works. And as a president of Nigerian Medical Association, for just yesterday, I was telling the media, I mean, that we need to have a roundtable to also get our people in the media to understand and appreciate this so that they can help us sell it back to the people. That, look, there are certain procedures that must also be, otherwise it'll be chaos. It's like what we're having now. Everybody with typhoid, with malaria, runs to the teaching hospital, to the tertiary hospital. And if they do not see them there, they complain. Whereas you ought to have first visited your primary doctor, primary care doctor, and of course move to the secondary before the tertiary. So these are challenges.
Mr. President, the problem is that is that the health centers are no longer there. Let me give you an instance. I mean, in the 60s and 70s, we had what we called the joint hospitals, hospitals that belonged to the church, to the community, and to government.
Yeah.
And I come from the southeast. In most of the southeastern areas, those hospitals were the real thing. They provided primary health care and all that. But today, none of them is standing. I mean, what happened to such, because we are talking about PPP.
Yeah.
You find out that was even established in this country in the 60s.
Yeah.
So how do we revitalize such corporations?
I think it's also making sure that we have a good legal framework, because a lot of people are very, very scared in investing in government entities right now, because occasionally it seems as if government is not a continuous affair. There's one good policy working now. People say, this is good, they jump in. Immediately that government leaves office, either at the state or local government, or even at the national level, becomes a new kettle of fish. So the investment atmosphere has to be secure. And then not only secure in terms of criminal justice system to get, should I say, to address whatever short changes you must have found out within the purview of the relationship, but also security of lives. If somebody comes to invest here and he wants to do a lot in the local community, and the next day he's kidnapped, you know, it's a big problem. Just this Christmas, a young man from the United States of America came to help his community to get a healthcare system going on. He was killed right on his doorsteps. So how do you expect other people to come to invest and do that sort of thing? And then talking about also at the local community level, the investment you're going to make, is it going to be good enough for you to be able to, or is the income going to be good enough for you to be able to make a very good return on investments? So these are some of the issues. It has to be something that will take gradually, and that's why I love the National Health Insurance Scheme that is now community-based. If we can revamp and make sure that the National Health Insurance Scheme is working as it is constituted to do, then it will mobilize a lot of resources for people, even at the local level, to get health care delivery in a way that it will suit everybody.
Okay, we take a break, and we take the comments of the minister not too long ago when he was on this program, reacting to some of the issues we have raised. Don't go away.
There are many reasons why someone may have to leave his or her country to go seek health care. And basically, we're a developing country, and it's not only health. I don't know how many things in this room are being manufactured in Nigeria. We'll import them. Why should we go out to import equipment for television? I ask you, for instance. Why can't we manufacture it here? So it is the level of our development. So having said that, what we've tried to do in the health sector is to see that as much as possible, we should be able to handle what is in the health sector. Now, that is not to deny people their human rights. The fact that someone goes abroad does not automatically mean that the condition could not be handled in country. and it's so clear, I've always told people, there are people in this Federal Capital Territory who still go to Lagos, who still go to Enugu, who go to Abakaliki for their health care. It's just out of preference. Probably that is where the doctor they are used to have always been. The second thing is there's this passion for something that is foreign. And it's not only limited to health. I've said this several times. I know people, I've talked to people who send their clothes for dry cleaning abroad. It doesn't mean that there are no dry cleaners in Nigeria, but again, there's a passion for foreign tests. Again, that does not mean the situation is here. So certainly, to answer your question, yes, without breaching patient's confidentiality, all I will say that the fact that that governor was taken out does not necessarily mean it could not have been handled.
But a lot of people thought that with the high-profile nature of that accident and what happened after it, that probably those in authority would have insisted that National Hospital, which is one of our best, should have handled it.
No.
After they stabilized
you cannot insist. Just like you now, if you go to a doctor, I'm a doctor, if you consulted with me, I made a diagnosis, and I tell you this is what I'm going to do. Your next question is, doctor, can you handle it? I say yes. And then you come back the next day with your relatives and friends and say you want to go abroad. Now, it is not my money. It is fundamental human right. Every Nigerian citizen has an inalienable right to go seek for health care any part of the world. Just like those in America, we've been treating patients who come from abroad here. They prefer to come home. It all depends on the patient. Okay. But what I've said as Minister of Health is that we're working on strengthening the policy, and we're going to do that. If something can be treated in Nigeria, and you're a public officer, then we don't have to use public funds to support your treatment. I don't know whether you're getting the point I'm making. Okay. We should never use public funds to support the treatment of something that is available here. That is what we're working for. How do we determine that? We are working on the process. I don't want to say so much, but the process will be such that at a certain level, we maybe have to require the minister to put in writing that, yes, he has investigated and this condition, either because of skill or facility, cannot be satisfactorily treated in Nigeria. Okay, Honorable Minister, let's look at the challenges of our health care delivery in Nigeria. You know, appropriate and adequate equipped medical facilities, trained personnel are very important. Yeah. And in the course of this program, we spoke to Nigerians, and a lot of them are saying that medical care in Nigeria is not accessible. Where it's accessible, it is not affordable. Well, there are some forms of accessibility. One is geographical. Okay? It is possible that maybe because there are no means of transportation or they are far. Okay? Nigeria is quite large. In some states that are very large geographically, the health centers, whether they are private or they are government-owned, are so far apart that sometimes it's quite far for our citizens to get to them. That is what we call geographical inaccessibility. Then there's of course, the one you've alluded to, the financial inaccessibility. Is the service affordable? Now, certainly we are working on that. What can be done? I'm proposing, and we're communicating that now that we're thinking of reviewing our constitution for a second time, probably two things can be done to ensure what I call, or what is known as universal health coverage. What is universal health coverage? Universal health coverage is providing quality health care that is affordable to everyone. So you're addressing equity. Now, how can we achieve that? One is the payment options. Right now, 70% of Nigerians have to pay for health care out of their pocket. And when we calculated it the last time, it runs into several billions that if we put this kind of money, the kind of facilities in terms of number and in terms of quality, I mean, will be much improved. But we're all going as individuals and spending out of pocket. Now, what is the problem with spending out of pocket? It is not reliable because at the time you have a major A health, what you have in your pocket may not often be sufficient to cater for it. So it's not reliable. It is not something we can predict. So it's not in. What is the reliable one? Everyone agrees that it's some kind of health insurance. So if we can make in the constitution that health insurance is mandatory, it's compulsory. I mean, for vehicles, it is so. If you have any kind of vehicle that you're going to use, mandatory, that's what our law says.
Are you saying
how much more for a human being?
Are you saying that the NHIS is not
mandatory?
It's not effective?
No, NHS, I will not say it's not effective, because first you have to understand what is the NHS. The
Okay, you're saying that it's not mandatory.
It was never the law.
You're looking for one that should be mandatory.
Optional.
You're looking for one that should be mandatory.
Yes,
for every individual.
Because why do we make vehicles mandatory and not voluntary? So if we can take people's right and say, I'm saying that like countries that we are trying to emulate, even developing countries, some of them are like countries like Thailand, countries like Vietnam. In those countries, health insurance is mandatory. In their own case, if you even put it in their constitution, we should do likewise. Then, to ensure that universal health coverage, what's the other amendment we need to do? We need to go to the schedules and say, it is the responsibility of, say, the state governments to ensure that within a certain distance, we don't need to be in a hurry. We start in a modest way and progress. We can stay with 5 kilometers. I would like a situation where within 2 kilometers, you have a health facility. But we can start gradually. 5 kilometers is okay. So within 5 kilometers, there should be a health facility. It doesn't matter who owns that health facility. It could be the federal government, it could be the state government, it could be the local government. It could even be the private sector. It doesn't matter, but the state should ensure that within 5 kilometer radius of any citizen or any resident of Nigeria, you have a health facility. With these two measures, then it becomes both geographical and
financially affordable.
No, financial accessible.
Financially accessible.
Yes.
Okay, you talked about the tertiary institutions, and what comes to mind is the university teaching hospitals all over the country. Our investigations show that as we speak now, in some teaching hospitals, nurses and doctors at night treat patients with torchlights because you don't have standby alternative power supply, and they don't have the funds to keep buying diesel to maintain these facilities.
Federal teaching hospitals?
The federal teaching hospitals.
Like which one?
A couple of them.
No, name them, because there's none. I can tell you confidently. So if someone is not doing his duty, we have taken care of that. We have standby generators. If there's any of them, that is your duty also to help us as media. You give that information to the minister, we confirm, and we take action.
What kind of funding do they have?
Well, funding comes from both internally generated revenue and from what is provided directly as subvention to them. It may never be enough, but there's no place in the world, go and ask anybody, there's nobody that's ever said that funds are sufficient, nobody, even the developed countries. But what is important is how do you manage the little you're having, okay? The federal hospitals get a lot more money than many of the state-owned hospitals. I've run a state-owned hospital, and we're able to even make them more functional than a lot of the federal hospitals. So what is important is management, because you will never have enough funds to do anything. So forget it, it's an utopian situation. It's never. Because the more you start seeing funds, the more your dreams become wider. Your vision extends, and what you want to do, you become more ambitious. So you never get to that, whether in personal life or in corporate life. But what is important is that whether in personal life or corporate life, whatever you can get, you should be able to manage it more efficiently.
You have a system of monitoring.
We have a system of monitoring.
You funded this.
So I've never gotten in recent times this kind of complaint. I'm not aware.
Maybe the next time we are going to have
No,
this
just let
program,
us know, because I can tell you confidently, Nigerians, if it's a federal teaching hospital, that has not happened in the last 1 year.
How do you monitor?
We don't monitor. We have a department that has an inspectorate division, the Department of Hospital Services. We also ask people to inform us, okay? Now, there are many mechanisms of informing us, but what we want to do now is to centralize. Before my predecessor left office, he embarked on a scheme where we wanted to have a central number that can even make it possible for a patient or patient relative to complain in any of our federal hospitals so that the minister will even know. We're resuscitating that. We're holding meetings with the networks, and very soon we'll resuscitate that.
Okay, Honorable Minister, we'll take a break. When we return, we'll look at the other things that are impeding effective health delivery in Nigeria. Don't go away. Frontline continues.
Well, I wouldn't say it is accessible, affordable, because of the cost, the inflation cost in Nigeria. There's a lot of high price of medication, medicine, and even consultation. So I can't say it is affordable.
To a very large extent, healthcare is accessible, but there is not much information to let people know where to go and at what point to go. But when you talk about affordable, I would disagree about affordable. It's not quite affordable here in Nigeria.
Yes, with regards to healthcare in Nigeria, I would say that even the government is trying, but government is not able to do sufficient. So there should be some complementary effort, such that healthcare should be brought, to the doorsteps of the common man. They need some improvement on healthcare services.
Government is not sincere about this health insurance. People don't trust the, such organizations again because of the, corruption in Nigeria. Otherwise, the health, insurance would have been the absolute solution to health care.
Welcome back to Frontline. My guest is still the Honorable Minister of Health, Professor Onabulele. Recently, you engaged some doctors in diaspora. And I've also interacted with some doctors in diaspora. And they've expressed some fear about coming home, either to work for government or establish their own hospital. They've talked about the high cost of doing business in Nigeria. They've also talked about corruption, where they have to, bribe to get things done in the country. In your engagement, was there any way you reassured them with specific...
No, for me, I'm a practical man.
Yeah.
Anybody that says he can't come back to his country is not ready for some reasons. Some people say it's economic. Many people left the shores of Nigeria purely from the economic point of view. If someone is paying you better, you move. It's not restricted to medicine. It's everywhere. Even you yourself, someone pays you better tomorrow, you'll be tempted to move. So it's difficult to convince anybody that someone is paying you 2 times. When you convert the money in Naira, it becomes 3 or 4 times, and for you to come back in country to work. But if you want to come back, assuming you have sorted out basic problems like you've trained your children, you built a house in your village, that's what I tell them outside, and you are generally comfortable, the basic necessities of life, and you now want to do better by now helping your society, you then return. There are opportunities when you come back. But if you are going to come back to complain, then you're not ready to work for your country. The place you're running to, America, remove 100 years from the health sector. They had nothing. 100 years ago in America, do you know how you become a doctor? If you train under Professor Onabulele, it's like apprenticeship. When I'm happy with you, you can buy things for my wife. She sends you to market and all that, and you are an obedient guy. I look at you, you are doing well, you've learned a few things. I give you a certificate, a testimony, and I do what Nigeria used to call freedom. That is 100 years. Just remove 100 years from America. Today, look at where America is. Why cannot people desire to get their country that way? You're talking about corruption. Who is accusing who? Corruption starts from even at home. Go and see what parents are doing at their home. Is that not corruption? It's not only one government that is corruption. Look at the private sector. Right now, as a minister, sometimes I no longer know what to say. I used to think the private sector was better off. But now, with recent revolution, private sector is not even better in terms of corruption. But so what is the point? The point is that corruption is something the individual has to fight by himself. The country will make laws and enforce those laws. But it's the individual, right from home, even in the religious bodies, there's corruption. So people should stop telling me about corruption.
Honorable Minister, are you going a step further?
No, what I want us is, I want us in Nigeria to remove certain things. There are certain words we use in Nigeria that I think we should just discard and get on with the business. One is this idea of corruption. If someone is corrupt, report the person. If someone says, give me bribe, refuse to give bribe. For goodness sake, I report that.
But you're frustrated.
Don't get frustrated. There's nothing, you pay a price for anything. Look at Americans. They were queuing up for hours. If it's in Nigeria, they were attacking INEC. Nobody's attacking Americans, but they queued up. They queued up. Till 12 hours, people were queuing up in the sun to vote.
So on the 24th of October, the Federal Executive Council approved the pharmacovigilance policy. A lot of Nigerians really don't understand what this means. How can you break it down for us?
Pharmacovigilance simply means the science of prevention, assessment of safety of drugs. Now, you know, the issue with drugs is that often there's hardly any drug that you give that does not have side effects. And some of these side effects can actually be very severe, that they can even lead to death. We call all of them adverse drug reactions. So the monitoring, the evaluation, the assessment, the identification, the understanding, the prevention of these adverse drug effects is what is known as pharmacovigilance. Yes, the country has now a policy that has been approved by the Federal Executive Council of Pharmacovigilance. So we are putting a framework, a policy as it were. How can we ensure that we monitor the effects of drugs? Now there are two ways. One is what we call pre-marketing, and one is the post-marketing. Now pre-marketing means before any drug is introduced anywhere in the world for public use, it has to undergo what is known as clinical trials. And there are a number of phases, at least 3 phases, in some cases even a 4th phase. That is pre-marketing. Now, even at that, while we are doing clinical trials, we do understand a few of the adverse drug reactions, but you will never be able to know everything completely. So there's need to continue to monitor possible adverse reaction even after the drug has come into clinical use. That's what we call post-marketing. So that's what pharmacovigilance is all about.
I can't end this program without asking you how you engage in the private sector.
The administration of Dr. Goodluck Jonathan has come to the conclusion, which has been conclusion of many governments, but now something is being done, that obviously certain kinds of health care may never be able to be provided in ordinary Nigeria in terms of geographic and accessibility and so on, unless the private sector is encouraged. And therefore, we are trying to encourage investors by government saying, no, we don't have to always build a hospital. In any case, many times when we have built it, people decide to go on strike, and eventually people make the place inefficient because they think it belongs to government and nobody should be able to get value for money. So we said, okay, if private sector believe they can invest, what will be the role of government? The role of government is to provide the enabling environment. And what are those enabling environment? The government is tackling power. We don't expect that if you want someone to come and build a hospital, you should be the one also generating electricity. It's going to be very expensive. So power. What about water? Government is doing something on water. What about regulation? We are making a regulation. This is where you register. These are the standards and so on. Okay. Now, are there things, what they call incentives, that we can give to you? Now, we have set up a committee under Mr. Tony Elumelu recently. It's a very high power committee, but it's not government committee as it were. And they're working hard. People who experience it, from even not just Nigeria, but from even outside the country. Those who are Nigerians, we invited them, they are serving. And what we want them to do is come up with this kind of package of incentives, which we take to the Federal Executive Council and say, this is what we think we should do. And they're working hard on that. Apart from that, we have the private public sector health alliance, which is made up of people like Jim Ovia, Tony Elumelu, Dangote and Co. Many people in the private sector, corporate bodies, individuals, we're working with them. They're also doing work along that basis. And whatever is their recommendation, we'll look into them and see the ones we can implement. But what is important is that the president says he's challenging the private sector. Can they even start with at least 6 world-class private-owned specialist hospitals? And people are coming on board now. On the part of government, we've entered into a number of MOU. For instance, the one we entered with GE, General Electric, which is a very big global company. And already quite a number of Nigerians, both in the diaspora and in country, have been meeting with GE to work out how they're going to establish these centers.
I must thank you, Honorable Minister, for coming on our program.
Thank you very much.
So, gentlemen, let me have your last word on how we can ensure that primary health care is available to majority of Nigerians.
Well, first is to have what I consider as top-level political commitments towards driving healthcare and healthcare delivery. Commitment to the health of the people of Nigeria at all levels, and that means those in government who have been so elected must see it as a very top responsibility to drive that process. 2 is to ensure that we have a legal framework for health, one that clearly prescribes roles and responsibilities for the tiers of government, and also fundamentally makes health rights justiciable rights so that we can call people to account. Again, we need to be able to drive, appropriate budgetary provisions for healthcare. And that is why the issue of even reviewing the revenue sharing formula comes in. Right? Because you cannot expect the base that is supposed to be closest to the people to have the least resources to drive health and drive progress for the people of Nigeria, for the people at those local government levels. So the issue of resources is also very important, because you cannot expect a man with the least resources, and because primary care is a serious responsibility. So we need to also tinker with the issue of the local government system administration in all ramifications, in terms of fiscal responsibility, in terms of political autonomy, political responsibility, and of course the whole issue of getting them empowered constitutionally. Because the only provision, even in the Constitution of Nigeria section, the fourth schedule of the 1999 Constitution as amended, is so sparse as to local government responsibilities for health. So that has to be strengthened to make them more accountable to the primary needs of the
Dr. Oji, your last word.
Well, my last word will be to the line of Mr. President of NMA also. But the most important thing is to, I always like to look at things, short-term measures and long-term. What he has talked about is a long-term measure to make sure these things are properly addressed. But the short-term measure is that we have a mechanism on ground now, the National Health Bill. With that National Health Bill, there is evidence that it is justiciable with things that I need. If it's put into acts, I can go to a hospital. If I don't get the kind of service that I expect, I can sue. It's the ability to sue and also the fear of being sued and making to pay that will make people do their work in a civil democratic process. Lastly, it is also important to understand that our healthcare system, one of the banes of our healthcare system is the inability for us to manage appropriately, efficiently, and effectively the resources that we have. Lastly, we must continue to preach PPP. And one of the areas I feel that PPP will do a lot of good to us is to help doctors get soft loans, very low interest rates, and above all, management. I keep emphasizing on that. Not just within the healthcare, private healthcare system, but also within the public health system.
Well, gentlemen, I'd like to thank you for your time and your insight on this topic. I always say that talking about health and some of these development issues is work in progress, so I'm sure we're going to have several other programs talking about it, talking about the health bill and all that. I must thank you, Mr. President, Dr. Osahon Onabulele, who is President of the NMA. Thanks for coming.
Thank you very much.
I must thank you, Dr. Ejike, who is Country Director of IPAS in Nigeria.
Thank you,
thanks for coming.
Thank you.
Don't forget, you can join the conversation on Facebook, follow us on Twitter, send us text or email, or watch this and our previous programs on www.frontlineng.com. That's Frontline for today. From Abuja, Nigeria, I am Obiora Ilo.